The COVID-19 pandemic is reminding us once again that mental health is just as important as physical health. As the economic and social impacts of the pandemic expand, we can expect to see a rise in mental health conditions such as depression, anxiety, and substance use disorders. Frontline health workers faced with heavy workloads, life or death decisions, and risk of infection are particularly affected. So are children and adolescents, whose daily routines have been completely disrupted. Older people, particularly those living alone, are at risk of social isolation. This is to say, nothing of the situation in settings where poverty levels are high and physical distancing is complicated, if not impossible. If ever there was a time to invest in mental health, it's now. Although 30% of years lived with disability are caused by mental health conditions, just 2% of government health budgets are for mental health. Fortunately, it's not too late to redress the balance. Support for mental health must be integrated into every component of national responses to COVID-19. We must use this opportunity to build mental health services that are fit for the future, inclusive, community-based, and affordable. Because ultimately, there is no health without mental health.
The World Health Organization is calling for urgent and sustained actions to address the growing mental health crisis across Africa. In a message marking this year's World Mental Health Day, the WHO Region Director for Africa, Dr. Mohamed Janabi, warned that the continent's fragile health system are being stretched to breaking points by recurring conflicts, disease outbreak, and natural disasters. Dr. Janabi described mental health care as a lifeline, not a luxury, stressing that 1 in every 5 people affected by Africa's emergencies develops a mental health condition requiring professional care. He said this year's theme, Access to Service, Mental Health is Catastrophe and Emergencies, reflect a growing concern across the region. Africa records over 100 major public health emergencies each year, yet mental health and physical-social support remains severely underfunded and under-integrated. International Response System. Only 11 African countries have included mental health support in their national disaster plans, and less than half have dedicated budgets for mental health. Regional spending currently stands at below 50 cents per person. Dr. Janabi warned that the lack of investment leaves millions without help. When crises strike, emphasizes the urgent need for government to commit greater resources, integrate mental health into emergency frameworks. The trained responder is psychological first aid and strengthen community-based support systems. The WHO says prioritizing mental health in Africa's emergency response is not just about healing minds, it's about building resilience, restoring dignity, and saving lives. Nigeria has lost one of its most respected elder statesmen and moral voices, Dr. Christopher Kolade, who passed away at the age of 92. His family announced his passing in a statement on Wednesday, October 8, 2025, expressing gratitude for what they describe as an incredible life of faith and service. Born on December 28, 1932 in Erin Oke, Osun State, Dr. Kolade was the son of an Anglican missionary. He attended Government College Ibadan and later for Bale College in Sierra Leone, where his brilliance stood out early in life. His career began in broadcasting, rising through the ranks to become Director General of the Nigerian Broadcasting Corporation. He later transitioned into the corporate world, serving as chief executive and chairman of Cadbury Nigeria plc, where he became known of his integrity and ethical leadership. Dr. Kolade also served as Nigeria's High Commissioner to the United Kingdom, where he represented the nation with distinction and grace. After his diplomatic service, he devoted his later years to education, teaching corporate governance and leadership at the Lagos Business School and the School of Media and Communication, both under Pan Atlantic University, where he also served as Pro Chancellor. Beyond the classroom, Dr. Kolade was a pillar in several professional and ethical institutions, from the Nigerian Institute of Management to the International Institute for Communication and the Convention on Business Integrity, which he chaired. In 2012, he was appointed by then President Goodluck Jonathan as chairman of the Subsidy, Reinvestment and Empowerment Program (SHORP) board. A man deeply committed to transparency, faith, and good governance, Dr. Faith Kolade leaves behind a legacy of honor, integrity, and selfless service that continues to inspire generations. Thanks for stopping by.